Before we start, subscribe to BOZhealth and share this video with your friends and family. If you care about your health and the health of your parents, stay with BOZhealth and watch this till the end. My name is Dr. BOZ. I am a surgeon. I have been working as a surgeon for 22 years. I have spent countless mornings walking into the operating room before sunrise and leaving after sunset. I have seen surgery save lives. I have seen it fix problems that once had no solution. Because I know this world from the inside, I need to tell you something most doctors do not say openly. There are 5 surgeries that in most situations I would not recommend to my own parents. Not because surgery is wrong. Not because surgery is never needed. Sometimes surgery is the only option. But I have seen many times what happens when people over 65 go through certain surgeries and in certain conditions. What I have learned can change how you think about your health and your parents' health. In this video, I will explain all 5. I will tell you why the risk increases after 65 even if someone looks healthy. I will also tell you what you can do instead. Because in most cases there is always another option. This is the same conversation I have with my own family. Now I am sharing it with you. Before I explain the list, I need to give you a simple way to understand the problem. Without this, the surgeries will not make sense. It is based on one medical concept that most patients never hear about. This concept is called frailty. Forget the age written on an ID card. Frailty is not the same as age. Frailty means how strong your body's reserve is. It is your body's ability to handle stress and recover. It is your biological backup system. Imagine your body is like a battery. In your 30s, that battery is fully charged. You can work late, sleep less, get sick, eat badly for a few days and still recover quickly. Your body can handle it. As you grow older, that reserve slowly decreases. By your mid-60s, your battery may be at 60 or 70%. And I want you to understand this clearly. 60 or 70% is still good for daily life. You can walk, cook, travel and feel normal. Your daily activities do not drain your battery too much. But major surgery is not normal daily stress. Surgery, anesthesia, cutting tissue and healing put huge pressure on the body. It is like plugging a heavy machine into a small home outlet. Daily life is light usage. Surgery is extreme usage. When your battery is already at 60%, this kind of stress can drain it to zero. That is when serious problems happen. Think about the last time you had a very bad illness. Not a small cold, but a strong flu where even standing felt difficult. Your body was fully focused on fighting that illness. Now imagine having major surgery at the same time. Your body would need to fight, heal, and recover all at once. That is an enormous burden. This difference between how you feel on a normal day and how your body reacts under extreme stress is what frailty measures. The hardest part is that frailty is invisible. You cannot see it from the outside. Someone who is 72 may be very strong inside. Someone who is 68 may be very weak. You cannot judge it by appearance. Studies from Johns Hopkins showed that frailty predicts surgery problems better than age alone. It predicts complications, hospital admissions, and long-term care needs. The number on a form means very little. Your body's reserve means everything. Now here is the second thing you must remember. The biggest danger is usually not planned surgery. The biggest danger is emergency surgery. Emergency surgery happens when a small problem is ignored until it becomes a crisis. When that happens, the body is already weak and stressed. Then surgery becomes much more dangerous. This is why early care, good planning, and smart decisions are so important. In the next part, I will explain this with a clear comparison so you can understand it better. Before we continue, please subscribe to White Health and share this video with your friends and family. If you care about your health and your parents' health, stay connected with White Health and watch till the end. I want to explain this in a way you can really feel. A planned surgery is like landing a plane on a clear day with enough fuel, great train crew, and a safe runway. Everything is prepared. Everyone knows what to do. Emergency surgery is like landing that same plane in a storm at night with low fuel on a runway that was never checked. The situation is dangerous from the start. The results cannot be compared. In adults over 65, emergency abdominal surgery carries a hospital death rate between 7 and 15% depending on the case. In frail patients, research shows this number can rise to 25% or more. That means 1 out of 4 people may not survive. These are not just numbers. These are real lives. Most emergency surgeries begin as small problems that were once easy to manage. They had simple solutions. But they were ignored, delayed, or normalized until they became disasters. That is the common link between every surgery on this list. Now let me explain the first one. The first surgery is emergency removal of part A or all of the large intestine. This is how people usually reach this point. As we age, the colon can develop serious problems. Small pockets can form in the wall and become infected. This is called diverticulitis. Colon cancer can grow silently for years without clear symptoms. Inflammatory bowel disease can slowly become dangerous. When surgery is planned in advance, colon surgery can often be done through small cuts using a camera. The doctor can prepare the patient. The body can be strengthened. The timing can be chosen carefully. The risks are real, but they are controlled. Emergency colon surgery is completely different. When a pouch busts or a hidden tumor blocks the intestine, waste and bacteria leak into the abdomen. This causes a severe infection. Without immediate surgery, it can be deadly. By the time the patient reaches the emergency room, many are already in early septic shock. There is no time to prepare. The abdomen is opened quickly. The infection is cleaned. The damaged section is removed. For a body with low reserve, this is not manageable. It is nearly catastrophic. Large studies of people over 65 who had emergency colon surgery show death rates close to 16%. In frail patients, many studies show rates above 25%. Among survivors, complications like pneumonia, kidney problems, and poor wound healing are very common. Now I want you to connect this to real life. Think about the last time you or someone close to you noticed something slightly wrong. Maybe digestion felt different. Maybe there was discomfort. Maybe energy was lower. Nothing dramatic. Nothing scary. Just something easy to ignore. So you blame food, or stress, or age, and weeks passed. That response feels normal. It feels reasonable. Most of us do this. And most of the time the body fixes itself. But colon cancer and diverticular disease do not fix themselves. They slowly get worse. The window between this can be handled with a planned procedure, and this is now life-threatening, can close quietly without warning. Now here is the good news. And this is very important. Colonoscopy starting around age 45 or 50 allows doctors to see the entire colon. Small growths that may turn into cancer can be removed right away. This is a simple outpatient procedure done with sedation. A colonoscopy is not just a test. It is prevention. It is the alternative that can turn a future emergency into a safe, controlled situation. Before we continue, subscribe to Vita Health and share this video with your friends and family. If this information matters to you, stay connected with Vita Health and watch till the end. Early care can turn a disaster into a simple Tuesday morning appointment. That is how powerful prevention can be. A diet high in fiber, vegetables, beans, and whole grains with less processed meat lowers colon cancer risk in ways science understands well. Walking for 30 minutes most days also reduces risk. These are not vague lifestyle tips. These are proven actions that lower the chance of ever facing an emergency surgery. If you notice long-lasting changes in bowel habits, blood where it should not be, and explain weight loss or pain that keeps coming back, do not ignore it. Do not normalize it. These are warning signs. They deserve attention. The second surgery is emergency repair of a perforated peptic ulcer. A peptic ulcer is an open wound in the lining of the stomach or the upper part of the small intestine. The two main causes are a bacteria called H. pylori and long-term use of pain medicines like ibuprofen, naproxen, and aspirin. These medicines are often taken for arthritis or joint pain. These drugs work by blocking chemicals that cause inflammation. But those same chemicals also protect the stomach lining. When they are blocked for a long time, the protective layer becomes thin. Stomach acid then slowly damages the tissue underneath. Most ulcers found early do not need surgery. They are treated with acid-reducing medicine like omeprazole or. If H. pylori is present, antibiotics remove it. In most cases, the ulcer heals and no operation is needed. The danger comes when the ulcer is ignored. It grows deeper and eventually makes a hole in the stomach wall. Acid leaks into the abdomen. Severe infection begins immediately. The pain is sudden and extreme. At this stage, surgery is the only option. Studies show that in people over 65, emergency ulcer surgery has a death rate between 15 and 25%. Many survivors face serious problems like kidney failure, breathing issues, and confusion after surgery. Now think about this carefully. Think about how you or someone close to you uses pain medicine every day. Ibuprofen for knee pain. Naproxen for shoulder pain. It is easy to buy. It feels safe. It has been used for years. Nothing on the label feels urgent. I am not saying this to scare you. I am saying this to help you see clearly. Daily long-term use of these medicines after age 65 without stomach protection creates real risk. Not imaginary risk. Real risk proven in studies. There is one simple question to ask your doctor. I take anti-inflammatory medicine regularly. Should I also take a stomach-protecting medicine? That one question may protect you from a life-threatening emergency with a 1 in 4 chance of death. The third surgery is emergency removal of part of the small intestine. The small intestine is where your body absorbs almost all nutrients. It keeps you alive at the most basic level. When blood flow to part of it is blocked, damage happens very fast. Once the tissue starts dying, it is very hard to reverse. If this problem is not treated quickly, emergency surgery becomes the only option. And at that point, the risks rise sharply, especially in older adults. In the next part, I will explain how this happens and how it can often be prevented. Before we continue, subscribe to Vita Health and share this video with your friends and family. If this information matters to you, stay connected with Vita Health and watch till the end. Problems in the small intestine can happen for several reasons. Scar tissue from past abdominal surgeries can block the bowel. A hernia can trap part of the intestine. Other structural problems can also cause blockage. Loss of blood flow is another serious cause. This is called intestinal ischemia. It usually happens when a blood clot blocks one of the main arteries that supply the intestine. It is more common in people with heart disease, irregular heartbeat, or blood clotting problems. If a large section of the intestine is damaged, it must be removed. When too much is removed, the body cannot absorb enough nutrients from food. This leads to short bowel syndrome. In this condition, a person may need long-term intravenous nutrition. This is not temporary. It permanently changes how someone lives. Now I want you to think about this personally. Think about how most of us react to stomach cramps, nausea and vomiting. We usually assume it is something we ate. We rest. We drink water. We wait a day. Most of the time, this is the right choice. The problem goes away. But in adults over 65 who had previous abdominal surgery or who have heart problems, the same symptoms that do not improve can mean something serious. It can be a bowel blockage or loss of blood flow to the intestine. Catching this at 6 hours instead of 48 hours can mean the difference between simple treatment with fluids and losing a large part of the intestine forever. I am not saying every stomach pain needs an emergency visit. It does not. But I am saying this clearly. If you are over 65 and have a history of abdominal surgery or heart disease, then you have ongoing abdominal pain with vomiting, you should get medical care. A simple scan can quickly show if it is dangerous or not. The fourth surgery may surprise you because it involves two very common procedures: removal of the appendix and removal of the gallbladder. These surgeries are usually safe. The problem is not the surgery. The problem is delay. Older adults are more likely to have unclear symptoms. This delay can turn a simple operation into a dangerous one. In younger people, appendicitis is usually obvious. Pain starts in the lower right abdomen. Fever and nausea get worse quickly. Most people go to the hospital within hours. The appendix is removed before it bursts. The surgery is done with small cuts. The patient goes home the next day. In adults over 65, symptoms are often mild and confusing. Pain may be vague. Fever may be absent. The classic signs may not appear. So people wait. And this is understandable. By the time they reach the hospital, the appendix has often already burst. Infection has spread through the abdomen. A simple surgery becomes major open surgery. Cleaning, drainage, and long recovery are needed. In simple cases, appendix removal has less than 1% death risk. But when the appendix has burst in older adults, death rates rise to 5 to 10% and higher in frail patients. The gallbladder follows the same pattern. Early surgery for gallbladder infection is manageable. But when the gallbladder becomes severely infected and damaged, the risks increase greatly. Now I want you to think carefully about this. Think about how you or someone close to you reacts when pain is mild and clear or comes and goes. In the next part, I will explain why ignoring these signals can be dangerous and what you should do instead. Before we continue, please subscribe to Vita Health and share this video with your friends and family. If this information matters to you, stay connected with Vita Health and watch till the end. When someone close to you feels a new and unfamiliar discomfort, the first response is usually patience. We rest. We take mild medicine. We hope tomorrow will be better. This is sensible. Most of the time, it is the right choice. It prevents unnecessary hospital visits. But here is the difference you must understand. In older adults, abdominal pain that is not clearly linked to food and lasts more than when they should not be ignored. It should be checked by a doctor. The nervous system in older people does not always report pain accurately. What feels like moderate pain may actually be severe inside the body. A 4 out of 10 in feeling may be a 7 out of 10 in reality. Act early. Do not wait. That is the safest alternative for appendix and gallbladder problems. The same surgery done when they earlier can lead to completely different results. For gallbladder prevention, studies show that a Mediterranean-style diet helps. Eating more vegetables, olive oil, beans, fish, and whole grains lowers gallstone risk. Keeping a healthy body weight also reduces gallbladder disease over time. Now we come to the fifth surgery. This one is different. So far, every surgery had a clear message. Do not delay. Act early. Plan ahead. This one is different because sometimes surgery cannot be avoided. A broken hip must be repaired. A lung tumor must be treated. Surgery will happen. The question is not if. The question is how strong the patient is when they reach it. Here are the facts. In adults over 65, one-year death rates after a hip fracture range from 17 to 25%. People with hip fractures are 3 to 4 times more likely to die than others their age. Many survivors never regain full independence. A hip fracture is not just a bone injury. It shows that something was already weak. Bone strength, muscle mass, balance, heart reserve. These were declining before the fall. Major lung surgery has similar risks. Removing part of the lung reduces breathing capacity. Anesthesia, chest surgery, immobility, and low lung reserve increase the risk of pneumonia, blood clots, and confusion after surgery. Now think about this. Imagine you are given a surgery date 6 weeks from now. Most people feel nervous. They plan time off. They worry. But they do not usually prepare their body. The system does not encourage it. You get a date, a checklist, and instructions not to eat the night before. The hidden message is that you will arrive in whatever condition you are in. But what if you arrived stronger? This is called means preparing your body before surgery. It is a planned program that starts weeks before an operation to improve strength, endurance, and recovery ability. Think of it like training before a major physical challenge. It is not vague wellness. It is focused preparation. It has 3 main parts. Targeted exercise to build strength and stamina. In the next part, I will explain the other parts and how this preparation can dramatically change recovery outcomes. Before we continue, subscribe to Vital Health and share this video with your friends and family. If this message matters to you, stay connected with Vital Health and watch till the end. Focuses on strengthening the parts of the body most affected by surgery. For hip surgery, this means building leg and core strength. For lung surgery, it means training the breathing muscles. A patient who enters surgery stronger than they were 2 months earlier heals faster and recovers better than someone who arrives at the same weak level. Nutrition is just as important. Many older adults do not get enough protein even if they seem healthy. This weakness often appears only when the body is forced to heal after surgery. Studies show that increasing protein intake for several weeks before surgery improves wound healing and reduces muscle loss during recovery. Mental preparation also matters. Anxiety before surgery is not just emotional. It affects the body. High stress raises cortisol, disrupts sleep, and strains the nervous system. All of this slows healing. Learning about the procedure, having a clear recovery plan, and reducing fear improves outcomes and lowers the risk of confusion after surgery. Research has confirmed this. A major study in 2023 showed that structured before colon cancer surgery reduced complications and improved recovery. Similar results have been seen in heart and bone surgery patients. Now let us talk about prevention before surgery is ever needed. For older adults, vitamin D intake of 800 to 1000 units daily has been linked to fewer falls. Balance and strength training programs reduce fall risk by up to 30%. Reviewing medications with a doctor to identify drugs that increase fall risk is one of the simplest and most effective steps available. If you or someone you love is facing planned surgery, ask this question. What can I do between now and the surgery date to arrive stronger and healthier? If your care team does not give a clear answer, ask again. Push for guidance. That one conversation can change recovery. Now I want to leave you with the most important message of this video. Every surgery we discussed has the same root cause. A small problem became a crisis. Not because anyone was careless, but because no one explained how the rules change after 65. No one explained how body reserves shrink. No one explained how early action and late action lead to completely different outcomes. The difference between planned and emergency surgery is not small. It is the difference between a short hospital stay and survival itself. Surgery is not the enemy. Done at the right time with proper preparation, it is one of the most powerful tools in medicine. I have seen it give people many extra years of life. But surgery is also a major physical shock. It requires strength and reserves. When those reserves are low, the margin for safety becomes very small. Emergency surgery makes it worse. Lack of preparation makes it worse. Delay makes it worse. And you have more control over these things than you think. The colonoscopy you keep postponing. The medication question you have not asked. The symptom you have been quietly ignoring. The preparation program nobody mentioned. These are not small choices. They decide which path your health follows. If this video helped you or made you think of someone you care about, share it with them. Not to scare them. To start an important conversation. Leave a comment if you have questions. I read them and try to respond. Take your health seriously. Not out of fear. Out of respect for how much is truly in your control.